Hi viewers, today we are going to talk about a very interesting topic, that is glaucoma. I'm Dr. Rajinikantha. I'll be talking about this. As we become 40s, in our 40s, 50s, it is very important that we go to an eye specialist and have our eye pressure checked up. Everybody has heard of blood pressure. We know what is blood pressure. We keep talking about blood pressure is high, blood pressure is low. Similarly, eye also has got a normal eye pressure. We call that intraocular pressure. It varies between 10 to 20 millimeters mercury. So sometimes what happens is, without anyone realizing it, slowly the eye pressure reaches to 25, 30, 35, 40 and all. And this condition is known as glaucoma. When the eye pressure is more than normal, it is known as glaucoma. What will happen if there is glaucoma? We have a nerve which goes from the eye to the brain. That is known as the optic nerve. This optic nerve carries impulses from the eye and goes to the brain. So when there is glaucoma, because the eye is not able to withstand this high eye pressure, the nerve slowly dies. The nerve that is known as optic atrophy. Glaucoma is optic atrophy. Slowly the nerve fibers, they drop out, they die segmentally sometimes. Sometimes the whole nerve becomes completely atrophic. So we should not allow that to happen. It is preventable. So if we go and see a doctor after the age of 40, they will check everything, whether there's glaucoma or not. And if there's early glaucoma, we can start on eye drops. There are many eye drops available for this problem, which can control the eye pressure, bring it between this range of 10 to 20. There's something known as low pressure, low tension glaucoma also, but that is rare. And the usual eye pressure is between 10 and 20. So whenever it is little more than 20, 21, 22, we are very cautious. We immediately check whether there is any glaucoma or not. Some people come with 40, 50 also. Sometimes there is an angle closure glaucoma. That is an acute problem. The eye becomes very red and painful. And the person will say, well, since yesterday the eye is painful, we are vomiting, there's a headache also, eyes become red, we not able to see anything much. So then we check the person, we find that there is an acute angle closure glaucoma. In this people, we admit them immediately and put them on we give them mannitol drip to bring down the eye pressure. We also give them some oral glycerol. We put eye drops to bring down the eye pressure. And once the eye pressure is down, then we put them on some medicines which they should use routinely in their lifetime, and we call them frequently to check how they are. But sometimes if we think the eye pressure will shoot up again, then we bring down the eye pressure. It is absolutely essential that we bring down the eye pressure between 10 to 20. Then we can do surgery for them. Glaucoma surgeries are available. We can do that for them. So nothing to worry. Any stage of glaucoma has got treatment. Both the medical treatment is there, laser treatment is there, surgical treatment is there. So according to the type of the type of problem, according to the severity of the problem, we take decision how to do, what to do, when to do, and we treat them effectively. And it's extremely important that people who are 40 or so must come every 6 months to have this checkup done, so that we catch it early. When you catch it early, we don't allow this optic nerve to become atrophied. The optic nerve remains healthy. We put them on some medication to bring down the eye pressure. So that is not a problem at all. So glaucoma is a very important thing. Most people know about it. They'll come and ask us also. It runs in families also. It is sometimes they'll say, grandmother had glaucoma, grandfather had glaucoma, became blind. So please check up whether we have glaucoma or not. People are aware of this problem. And they also know that it runs in families, and there can be a genetic predisposition to this. So especially those with the family history of glaucoma, please do have your eyes checked up frequently, so that this is diagnosed early and treated early. This must have been a very interesting program. Thank you very much.